The pandemic may be far from over, but there are still plenty of lessons for us to learn. A joint investigation by the Health and Social Care and Science and Technology Committees of the Commons gave us its verdict today on the UK's handling of what it called the biggest crisis our country has faced in generations.
The national response to COVID was a bit like a football game with two very different halves.
The first half was the UK's preparedness for and early handling of the disease. For a start, the UK had prepared for a different pandemic, flu, instead of learning from previous outbreaks of infections like SARS and MERS.
Tonight, the first person in the UK to die after contracting coronavirus, a woman in her 70s in the Royal Berkshire Hospital.
But even as people started dying from the disease in the UK, the committee says the government, in line with advice from its scientists, resisted locking down for far too long.
There is a risk if we go too early, people will understandably get fatigued and it'll be difficult to sustain this over time.
So sporting events were allowed to continue, and when it was clear that the virus was now spreading in the community, government scientists recommended a strategy of delaying spread rather than trying to eradicate the disease.
Also, because most people, the vast majority of people, get a mild illness, to build up some degree of herd immunity as well, so that more people are immune to this disease.
And ministers, it seemed, had the same answer for every question.
I followed the advice of our world-leading scientists.
Been following scientific and medical advice.
The expert scientific and medical advice.
We must continue to follow the scientific evidence.
It was surprising, said the report, that the initially fatalistic assumptions about the impossibility of suppressing the virus were not challenged until it became clear the NHS could be overwhelmed. Part of the problem, says the report, was that the machinery of government decision-making was chaotic and underpowered. The inquiry heard evidence from the Prime Minister's advisor at the time, Dominic Cummings.
The Civil Contingency Secretariat completely collapsed under the pressure of this. They didn't have the people, they didn't have the skills, they didn't have the data.
NHS Test and Trace will help life get back to normal.
According to the committee, there were plenty of other failures to come. Despite being one of the first countries to develop a test for COVID as early as January 2020, the UK's first test and trace scheme was abandoned as a failure. It meant that the elderly were moved in and out of care homes without testing. The UK's vaccine programme, says the committee, was one of the most successful and effective initiatives in the history of UK science and public administration, which it says will ultimately save millions of lives. The success of the vaccine programme has redeemed many of the persistent failings of the other parts of the national response. That is, of course, of little comfort to people who lost those dearest to them. The report is called Lessons Learned. It contains a slew of recommendations, but they all depend on something that utterly failed, at least in the early part of this pandemic: the UK's state apparatus functioning quickly and well.
That was David Grossman. Joining us now is Fran Hall, whose husband Steve died with COVID and is a member of the COVID-19 Bereaved Families for Justice. Also joining us, Aaron Bell, the MP for Newcastle under Lyme and a member of the Commons Science Committee that co-wrote the report. Rory Stewart, a former Conservative Cabinet Minister, and Thomas House, Professor of Mathematical Sciences at Manchester University, who's a member of SPI-M's modelling subgroup. He's appeared in a personal capacity. We did, of course, ask the government to join us. No one was available. Frank, can I start with you? Does this report speak to what you and many other relatives feel needed to be said out loud?
It's a step in the right direction. I think I speak on behalf of many families tonight, and there has been so much upset and grief being demonstrated in the Facebook group. People have found it just desperately difficult to read in print what we all knew, that the government had failed us. And it's a step in the right direction, but what we need is the inquiry brought forward. We can't wait.
Do you need to see accountability?
Yes.
Or apology? What have you had any?
Accountability, no apology. I met with the Prime Minister along with some of the other campaign group last week, and he apologised for our grief, our loss. But an apology makes no difference. I'm curious as to what the lessons are that have been learned from this report. I see 40,000 people testing positive every day. 181 people have been bereaved. 181 families have been bereaved in the last 24 hours.
Yeah. So when you talk about the inquiry, and we're meant to be hearing about who will chair that by December for an inquiry to start in the spring, do you have confidence that is on track?
We have to have confidence that an inquiry will get to the bottom of what happened, but at the moment we don't know. We don't know who's going to chair it. We don't know what the terms of reference are going to be. The bereaved families need to be central to the inquiry, and the inquiry needs to begin as soon as possible.
Let me pick up with Erin Bell, if I can come to you. When you hear the words said out loud that this was one of the most important public health failures this country has ever experienced, I wonder if you feel a shame on behalf of your party in government, Erin?
Well, I think it's a systemic response that we're trying to address here. It's not about personalities in government. It's about the failings of the whole apparatus of the British state. We heard in your report from David Grossman about some of the failings in Whitehall, and indeed in Sage. I think there were elements of groupthink, as we discussed, as there's elements of fatalism. But I just want to say to Fran, my heart absolutely goes out to all the bereaved. I've spent time speaking to bereaved families in my own constituency. I visited the COVID memorial wall as well, and I know she wants the inquiry sooner. But I know that when the Prime Minister announced the inquiry, she called for a rapid review, and I hope that perhaps our report that we put together on a cross-party basis will, serve to be part of that, what she was asking for, the rapid review, so that lessons are being learned in real time. And that's been the purpose of what we've been doing on the committees. And it's been an absolute privilege to serve on those committees.
Fran, do you want to come back?
Thank you, Erin. But we were asking for a rapid review in June 2020, not when the Prime Minister announced the inquiry. If there had been a rapid review last summer, potentially many people might not be dead.
Well, I think the government has been learning lessons as we go along. Absolutely, that's been the case.
What lessons have been learned? Please tell me, what lessons have been learned?
I think we've learned an awful lot about the need for testing asymptomatic individuals. The test and trace programme, as we acknowledge in the report, got off to a very poor start because we simply didn't have the capacity, we didn't have the reagents, but we should have done better. And it took the intervention of the Health Secretary to do better. And we now have one of the best testing facilities in the whole world. It's the envy of other countries that we can conduct nearly 1 million tests a day. That is something the government has learned.
Well, before we skip forwards, if you like, I just want to go through some of the words in the report. They accused you of groupthink, British exceptionalism, fatalism, delays, slow, uncertain, chaotic, and critically a higher initial death toll than would have resulted from a more emphatic early policy. Why is nobody taking responsibility for that?
Well, those first 3 months, as we say in the report, the government was following the official advice, and I don't think it's helpful to try and point to a particular advisor for making the wrong call. I think what we've tried to do is get to the sort of systemic roots of that, Emily. The fact that there were not enough voices from outside the UK on Sage, and the fact that Whitehall wasn't as well prepared as it should have been. We thought we were well prepared, but as you said in your piece, we were prepared for the wrong pandemic. We had great preparation for influenza. We were ranked second in the world, ironically, just behind the US. But yet us and the US and other countries in Western Europe had really unacceptably bad outcomes compared to countries in East Asia. And we highlight that, and we say we should have been more willing to learn from countries that had already been through SARS and MERS, which are of course similar to coronavirus. So we weren't. We were a little bit blinded by the idea that we knew better and that people in Britain wouldn't respond in the way that they actually ultimately did, and the sacrifices that people did make when we asked them to make, and the fact that people were prepared to go under through lockdown for longer than the behavioural scientists had thought was likely.
Because there were voices telling you that what you were doing in government was wrong. One of those was Rory Stewart. So this argument that they were very well prepared, Rory, they were just preparing for a different disease. What do you say to that?
I think the whole thing is heartbreaking, and it was bizarre at the time. I mean, if we go back to February, March last year, it was clear that people were doing totally different things in East Asia Taiwan, South Korea, China. It was clear by the end of February that there was a very serious problem in Italy. But people like me and many others who were advocating for simple measures were attacked. So I advocated for face masks, and the Deputy Chief Medical Officer of England went out on television and said there was no scientific basis for face masks. I tried to suggest that we should control flights coming in. I tried to suggest that we should lock down gatherings and shut schools. And the tone at the time was unbelievably hostile. People who tried to say those kind of things were accused of being populists. And what was odd about it is that there was a sort of cross-party consensus. I was attacked not just by Conservatives, but also by Labour and Lib Dem politicians, and accused of being a hysterical populist for trying to suggest that Britain did what other countries around the world were doing successfully.
So you personally were accused of that, were you? I mean, you were getting messages at the time saying that, or it was just referenced?
Yeah. I mean, you can see it. I mean, you can watch the Deputy Chief Medical Officer of England saying this on television, naming me. And also, I was getting calls from the Cabinet Secretary and the Health Secretary and various others to try to tell me to stop saying these things. The problem was that we do not have a good system in Britain for politicians having a respectful but challenging conversation with scientists. Other countries are much, much better at doing this. Somebody should have said to the Chief Medical Officer, why are you so confident that there cannot be a vaccine before the end of the year? Somebody should have said, why are you so confident that face masks are going to make no difference? How can it make any sense to keep letting flights come in from Milan? These weren't very difficult questions, but it required politicians to be interested in the detail. And some politicians were. Angela Merkel in Germany, I think, had a much better track record on the way that she interrogated scientists.
So let me bring in Professor Thomas House on that one. Do you think that the government should have challenged your community, the scientists, more robustly? Or do you think that you're getting blamed now for decisions that weren't yours to take?
I think I would very much have liked to have had exactly the respectful, challenging discussion that we had, that Rory Stewart talked about, and not just with politicians, but with the public. The situation we were in very early on was that it was very hard to interpret data coming from China, which was seen growing linearly for reasons we didn't understand. We normally expect to see exponential growth. That meant there was a lot of uncertainty in the possibility of human-to-human spread until quite late in January. The best sign we had was of spatial spread in China, which was indicative of significant human-to-human transmission potential. At that point, I certainly believed we were in for a very bad pandemic, but I think it's also important to know how quickly any one of our scientific evidence just falls off. I have no idea how a modern society could respond to such a threat. So let me give you an example.
No, can I just ask you very, very briefly, can you respond to Rory Stewart's explanation that Jenny Harris, the Deputy Chief Medical Officer, shut down this idea of anyone having to wear masks because and told Rory Stewart that he was a populist who was sort of sowing unease amongst the public. I mean, isn't it extraordinary to think that the people at the top of the scientific chain who are advising the government were shutting down advice that you're now saying really everyone should have been open to?
Well, I don't know about who used what language, and I don't think we should accuse each other of things like populism and so on. But we can say that the evidence on face masks up until this pandemic has been extremely ambiguous. It took an event of this size to drive the research that was needed to find out exactly.
Well, not in Southeast Asia, it didn't.
No, I think the evidence was always mixed. Actually, there wasn't a strong consensus on the efficacy of face masks epidemiologically, and now we know much more. And I think we should be open to uncertainty. It doesn't mean that people on the science wrong. It often means that those projects have not been prioritised. So when we talk about being ready for even other contingencies, I think it's been a...
I'm going to bring in Rory. Yeah.
On this. I think one point is, as the professor is pointing out, a lot of this stuff wasn't researched and was quite uncertain. So it's not fair to expect scientists to give an absolute answer on these questions. But it does make sense for politicians to be prudent, to ask whether there is any harm in wearing face masks if the evidence isn't there. But the second thing is to understand that scientists are often specialists in particular areas. And we should have made sure that we asked the scientists the questions they knew the answer to, rather than relying on them, for example, to say whether or not the public was willing to lock down. One of the major problems was that we had people arguing that the public wouldn't accept a lockdown for more than 3 or 4 weeks. So there was this attempt to let the disease spread and land peaks and all this kind of stuff. Politicians should have been firmer about saying, let us deal with the question of what the public might be willing to do. That's our job as politicians. And ensure the scientists were giving advice on the things on which they were genuinely expert, rather than muddling the picture.
Aaron Bell, do you accept that there must have been a much better relationship between politicians actually taking responsibility for the decisions only they could make?
Yes, I think that's absolutely crystal clear in our report, that we've got direct quotes from both Dominic Cummings, who was the Prime Minister's chief advisor at the time, and from Matt Hancock, that they both regret not having challenged the scientific advice more thoroughly. They both said they found it very difficult to challenge the scientific advice, which had gone through a process of, peer review by SAGE, people within SAGE, but clearly it wasn't, sufficient, and we weren't getting the right answers as they turned out. And I don't disagree with Thomas or Rory that none of these things were absolutely clear at the time, but it's clear with the benefit of hindsight. And this report is with the benefit of hindsight, of course it is. It's about trying to learn lessons from what did happen. But it's clear with the benefit of hindsight that some of that early scientific advice, such as the mask wearing that you just alluded to, such as what we were doing about border control, was in fact wrong. And the government was following the scientific advice. You're right that perhaps the challenge could have been greater, but had the government turned around and said, well, this is the scientific advice, but we're actually going to do something different, then the media's response would have been absolutely deafening. The government wouldn't have lasted a week.
Fran.
In the face of a novel coronavirus, I think you have to follow the official scientific advice.
Fran, can I...
Thank you, gentlemen, for all of your input. I just feel that ultimately somebody has to take responsibility. Whether it's the Prime Minister or the cabinet ministers that were involved, someone is responsible for the situation that our country is in. And nobody so far is accountable.
But we haven't heard anything from the Prime Minister today. You would have thought there would be a comment, wouldn't you, Aaron Bell?
Well, I haven't heard from the Prime Minister today, obviously, but the Prime Minister has already set out, at various stages through the pandemic, that of course ultimate accountability does rest with the Prime Minister of a country who runs the government. But the idea that something as complicated and as complex as our response to the pandemic, which has had low points and extremely high points, as we heard about the vaccine programme and also the recovery trials, the idea that one person is solely responsible, accountable for it, I do sympathise, of course, with where Fran's coming from on this, but the whole point of this report is it's not about pointing a finger at individuals. It's about how we can learn lessons about the way our system works, the system of government, the system of advice, the system of standing up things like the test and trace programme. And encouragingly, we do seem to have learned some lessons on the way.
To you, Rory, is it enough that we interrogate our systems? If nobody resigns over this, if nobody loses their job, if nothing changes except for a sort of different approach to the system, is that enough for you?
I don't think so. I think this should be a massive wake-up call. I think people should be taking responsibility. I would have expected resignations that didn't happen. But more importantly, this isn't just about COVID. This is exactly the same problems we had on Afghanistan. I saw the same problems on flooding. I saw the same problems on Ebola. We have a very smug, closed government system that finds it very difficult to take external challenge.
Thank you all very much. We'll finish there. Thank you.